Hello, my name is Allison Forbes from Brandman University. Today I will be presenting Stakeholder Education Plan Implementation of an Evidence-Based Project. Objectives: describe the stakeholder groups involved, detail each stakeholder's role in implementation, identify educational needs for each stakeholder group, discuss the theoretical foundation of the proposed project, and outline a plan for delivering the intervention. Trauma is the leading cause of death for Americans between the ages of 1 to 44 years old. Centers for Disease Control and Prevention, 2014. Based on these statistics, trauma patients represent a large portion of our hospital population and encompass a majority of the emergency room cases. According to the CDC 2014, more than 180,000 patients lose their lives to trauma annually in the United States alone. Due to the high volume of patients, missed injuries often occur as a result, causing a huge burden on patients, healthcare providers, and hospitals. The incidence rate ranges from 1.3 to 39% in trauma centers nationally, leading to longer hospital stays, increased intensive care unit length of stay, significant pain, long-term disability, litigation, and death. Pfeiffer and Pate, 2008. The initial concept of tertiary trauma survey was founded by Anderson and his colleagues at the University of Tennessee. The process involved a thorough re-examination of the patient once life-threatening issues were addressed, and re-reviewing all laboratory and radiological studies. One proposed solution to minimizing missed injuries is to implement a tertiary trauma survey on all admitted trauma patients. Biffle, Harrington, Keofi, 2003. According to Melnick, Feinow, Overholt, 2011, Step 1 in evidence-based practice process is to ask a clinical question in the PICO format, describing the patient population, intervention, comparison, outcome, and time frame. The PICO question that I propose is: in adult intensive care unit trauma patients admitted within 72 hours, does implementation of a tertiary trauma survey compared to traditional care identify missed injuries over a 6-month period? Stakeholders. I will now discuss the stakeholders that will be involved in my project implementation. It is paramount that all key stakeholders, both passive and active, be incorporated into project implementation. Porter, O'Grady, and Malik, 2015. The groups that will be involved in my project are patients and their families, nursing staff on the surgical intensive care unit, providers such as nurse practitioners and physicians, intensive care unit medical director, the trauma surgery department, administration, such as the chief nursing officer, medical officer, operating officer, and quality improvement. The stakeholders' roles will be as followed: patients and their families to be amenable to the proposed intervention. The nursing staff will help identify appropriate candidates for the proposed intervention. Providers, more importantly, nurse practitioners, will be performing the tertiary trauma survey, while the physicians will be available for consult as questions arise during the intervention. The intensive care unit medical director will provide support to the project and facilitate implementation in the environment in which he oversees. Additional stakeholder roles, such as the trauma surgery department, will provide support to the project that's taking place on their patient population. They will include data collection of missed injuries into their quality indicator tracking system and provide a forum to disseminate monthly results to the stakeholders. Administration, chief nursing officer, support the project and ensure nursing staff support. Chief medical officer will ensure medical staff support. Chief Operating Officer will ensure the intervention goes smoothly and assist in overcoming potential barriers. The Quality Improvement Department will track missed injuries and also participate in delivering the results of the project. Educational needs of the stakeholders. Some of the educational needs identified were: the problem will need to be identified that I'm addressing, describing the value of the project, discussing the goals of the project, the plan to implement the project, training of staff, and expectations of the project. Educational needs of the stakeholders will be achieved through utilization of the Rossworm and Larrabee model of evidence-based practice and serve as a foundation to the stakeholder education plan to implement an evidence-based project. This model incorporates evidence-based practice, research utilization, and change theory. It's very intuitive, logical, and easily understood by healthcare providers with varying levels of expertise. There are 6 phases to this model. Initially, assessing the need for change in practice, linking the problem with interventions and outcomes, synthesizing best evidence, design practice change, implement and evaluate change, integrate and maintain sustainability. Rossworm and Larrabee, 1993. The plan for delivering the educational intervention. There will be a distribution of information regarding proposed intervention for this evidence-based practice project. This distribution of information will be through a 30-minute presentation developed on the project being presented. This will be done in a weekly unit council meeting for the nursing staff, the weekly physician trauma education conferences, and individual meetings with the Chief Nursing Officer, Chief Medical Officer, Chief Operations Officer, and Director of Quality Improvement. Part of the presentation will include the value of the project that will be integral in this distribution of information. The cost-benefit analysis will be summarized as followed. Costs associated with project implementation include distribution of information to hospital staff, project development, supplies, and training of staff, totaling $7,929.34. Cost savings. Cost savings to the patient for 1 day of decreased length of ICU stay, $12,000 per patient. Cost savings to the hospital for 1 less hospital readmission, $10,000 per patient. In addition to distribution of information to the stakeholders, there will need to be training. This will be completed via one-on-one with the 4 nurse practitioners on the trauma surgery service who will be solely responsible for performing the tertiary trauma surveys on the patients. Their training will consist of the presentation previously described that will discuss the project, the values and objectives, in addition to practicing the tertiary survey on patients admitted to the ICU. How will the stakeholders be kept informed of the project progress? This will be done by participating in monthly nursing staff unit council meetings to discuss the progress and results to the intensive care unit. This will also be accomplished by presenting at Hospital Trauma Committee and Trauma Quality Improvement Committee, where administration, physicians, and nursing leadership will be in attendance. Also, regular scheduled meetings with leadership and quality improvement will be done. How can the stakeholders facilitate the project? They can foster a supportive environment for innovation and change based on evidence-based practice. They can disseminate the information amongst their colleagues, provide mentorship and guidance through the process of change and implementation, give feedback and constructive criticism of the project, and lastly, suggest ideas to overcome potential barriers to implementation. Thank you. These are my references.